Good afternoon, and thank you for joining us today. This media briefing is taking place at the Wisconsin Department of Military Affairs, where staff from multiple state agencies continue to work out of the State Emergency Operations Center on the ongoing response to COVID-19. Joining us today are Major General Paul Knapp, Wisconsin's Adjutant General, and Department of Health Services Deputy Secretary Julie Willems Vandyke. They will be providing an update on the important work that continues to take place here at the SEOC. After some brief opening remarks, we will open the line to questions from reporters in the order in which their RSVP was received. We will go first to Major General Paul Knapp, Wisconsin's Adjutant General.
Good afternoon, ladies and gentlemen. I'm Major General Paul Knapp, and I'm Wisconsin's Adjutant General. I'm glad to be here this afternoon to update you on the role of the Wisconsin National Guard and our State Emergency Operations Center as our state's response to COVID-19 continues. This week, the Wisconsin National Guard has more than 1,400 citizens, soldiers, and airmen serving in direct support of the state's response to the pandemic. That's an increase of more than 400 since last week, as we've brought additional soldiers and airmen onto orders, primarily to plus up the state's testing capacity. We originally had 3 mobile testing teams, and we increased that number to 11 a few weeks ago, and we'll have 25 total teams operational by the end of next week, with more than 750 citizens, soldiers, and airmen supporting that effort. Those teams are responding to requests across Wisconsin. We have ongoing testing sites set up at multiple locations in Milwaukee, at the Resch Center in Green Bay, at factories and food processors in Racine and Grant County. Just today, we established another site at a meatpacking plant in Kenosha County, another community-based testing site in Burnett County, and another factory site in Crawford County. Last Friday, we supported the state's first community-based testing site in Buffalo County, and this week we transitioned the site at the Resch Center in Green Bay to a community-based testing location. The National Guard always serves in a supporting role. County health departments lead the efforts at each of these sites, and our Guard teams are supporting them. But as of the end of the day yesterday, our Guard teams have collected more than 7,500 specimens across the state. You can expect to see many additional testing sites supported by the National Guard in the coming days in communities all across Wisconsin as the state works to increase testing capacity. I can't even begin to describe how proud I am of all of the citizens, soldiers, and airmen from the National Guard and the men and women of Wisconsin Emergency Management who have selflessly answered the call to serve their state in this time of need. Likewise, seeing everyone from across state government working tirelessly behind the scenes at the State Emergency Operations Center to manage the state's response has just been awesome. This is truly an all of Wisconsin effort, and our residents can rest assured that there are thousands of hardworking people focused on the COVID-19 fight.
We will now hear remarks from DHS Deputy Secretary Julie Willems Vandyke.
Good afternoon, and thank you for joining us today. Our Badger Bounce Back Plan has many moving parts, all of them interconnected. And one of those integral parts is contact tracing, an important follow-up to the testing the General just mentioned. Contact tracing is conducted by local health departments, and during this time of a surge in COVID-19 cases, supplemented by state staff. In the past 2 months, DHS has brought on 208 contact tracers, and they have conducted over 14,000 contact tracing interviews since March. Now, as we increase our COVID-19 testing, we need to increase our contact tracing, which means we need to increase our contact tracing staff. The state job posting is currently on wisc.jobs. We are very excited about our initial response to this posting. Over 1,000 applicants applied in the first few days. The number of contact tracers we need will depend on the projected number of cases we will need to interview. Our goal is to interview every person who tests positive for COVID-19 within 24 hours and follow up with every one of their contacts within another 24 hours to provide them with guidance on isolation and potential testing. Testing, tracing, and tracking the spread of COVID-19 are our way out of this pandemic, and we thank all of you who have stepped up to apply for these positions and help your fellow Wisconsinites. But tracking is not enough to beat this virus. We also need to make sure that our healthcare system is well equipped to care for patients and that our fellow Wisconsinites have access to that care. When we talk about that care, we often talk about making sure our frontline workers have enough personal protective equipment. But there's so much more to patient care than simply equipment. And when we talk about access, we tend to talk about access to testing. But if that testing turns out to be positive, that means people will also need access to patient care. That is why Governor Evers and Secretary-designate Palm have issued Emergency Order 35, suspending certain administrative rules to make it possible for healthcare providers to really dedicate as much time and resources for patient care. The order allows for more flexibility when it comes to using telehealth to support Wisconsinites who need to access resources for mental health and substance use disorder treatment. Most importantly, for members of Medicaid, this emergency order ensures that no one will lose eligibility for coverage during COVID-19. This change will make it possible to receive federal funding under the Families First Coronavirus Response Act, and this increased funding will support our increased Medicaid enrollment and our increased usage due to the pandemic. DHS will focus our Facebook Live this Thursday on Medicaid and Food Share, so if you'd like more information about these programs, please bring your questions to that forum. Thank you.
Thank you. And at this time, we will open the line to questions. Reporters will be called on in the order in which their RSVP was received. In the interest of time, we'll be taking one question per outlet. All lines are currently in listen-only mode. Once called on, reporters should dial *6 to unmute their lines. Once you've asked your question, we please ask that you remute your line using *6 again. We will begin with Ryan Curry from NBC 26. As a reminder, Ryan, *6 to unmute your line. All right, we'll move on to Scott Bauer with the Associated Press.
I had a question. The Supreme Court earlier this morning heard arguments in the case attempting to block the current order. Has DHS done any preparatory work for the outcome or for the possibility that the court would block the order? Have you done anything to be ready for preparing a rule that you would have to submit to the legislature?
Well, Scott, what we've really done is focused on our efforts around Badger Bounce Back. The work we're doing here at the SEOC is intended to protect the health of Wisconsinites from this pandemic, and it is the work we need to do to continue to move forward. So the testing that the general talked about, the contact tracing, and these efforts to make sure that we can box in the virus as we move forward are really critical, and we will continue these efforts to protect Wisconsinites.
Thank you. We'll next go to Sean Kirby with Wisconsin Health News.
Hi, thanks for taking my question, holding this. I was wondering, Illinois is working on dismantling their alternate care facility in McCormick Place in Chicago as COVID cases are flattening in the state. Are there any similar plans or efforts to dismantle the facility at State Fair Park? Thank you.
No, there are no plans to dismantle that facility at this time.
Next, we'll go to Addie Bink with WFRV TV.
Hi, thanks for taking my question. I was just wondering if you'd be able to discuss whether there are any facilities outside of, meat packing facilities that either DHS or the National Guard is kind of keeping an eye on for potential testing areas.
Sure. We've talked about a number of facilities in the testing plan that was released yesterday. First and foremost, long-term care facilities. Our intent is to test all staff and residents at those facilities. That it's very important. Our most vulnerable citizens live in long-term care facilities, and we want to assure that we are boxing out the virus in those places as well. In addition to long-term care, the kinds of places that we're monitoring are settings where people work very closely together, and that is why we've seen outbreaks in meatpacking plants. It is possible that other work sites where people have to work very closely together can also be challenging in terms of disease transmission, and so those types of facilities are also on our radar. And then finally, any place where people live closely together are other facilities that we have attended to and done testing. So places like dormitories or jails or prisons where lots of people are living in close proximity is another type of site that we focus on.
Thank you. We'll next go to Riley Vetterkind with the Wisconsin State Journal.
So this question is for both the Deputy Secretary and General Knapp. So I'm looking for the coalition of Midwest governors. I understand that a big part of that coalition is information sharing. I'm just wondering if both of you could walk through the information that DHS and the National Guard are sharing and receiving from other Midwest states as part of the coalition, if any information at all. And could you possibly provide examples of what, if anything, you've learned from and shared with those other states since joining the coalition? I'm just wondering if some examples of those could be, what you've learned from how to deal with meatpacking plants or how to mitigate the virus in the African American community, for example.
Sure. Most of the direct conversations related to that coalition have happened through the various states' governor's offices. But I know from a DHS perspective, we are looking to the experiences of other states, both our Midwestern partners and states across the nation, such as places like Washington and New York and California that have gone a little before us at all times, so that we can be learning and moving forward together. One specific example is we've looked to Minnesota in terms of how we've stood up our testing program. And one example of something that we are using their wisdom to replicate here in Wisconsin is setting up an online map of testing sites throughout the state, and how we can, we're working on getting that set up here in Wisconsin so that we can make it very easy for members of our state to get to testing sites, just as Minnesotans can. General?
Thanks, Riley. In terms of the National Guard and our information sharing across the states, we do that in a number of ways, but one of the ways that has been very helpful is the Adjutant General call. So we have all of the Adjutant Generals from all of the 54 states and territories on a call with the National Guard Bureau either 2 or 3 times a week, depending on how the week is going. And in terms of examples, one of the things that we got early on from that network of other Adjutant Generals was the overall method that we're currently using for our community-based testing sites, the drive-through testing sites that you've seen on the news. We got a blueprint of that from the first states that were putting those into practice, New York and Washington, to name a couple. And then those products have been refined over the last 2 months to get to where we are today across all of the National Guard across the U.S. And in terms of what we've helped with, we've actually been receiving a lot of calls lately from other states asking us for advice on how to integrate the National Guard into the election process. What we did during the April election has kind of become a template for the rest of the United States in terms of keeping testing sites as safe as possible during the pandemic.
Thank you. We'll next go to Jeremy Janine with Urban Milwaukee.
Question for the Guard in terms of scale we're testing. How many sites, additional sites or teams could the Guard mobilize to support the state with? How many members are working at a single site?
Okay, so talking about the sites. The sites are very different. There are 3 different types of ways that we can assist in testing. One of them is to augment a medical staff at a medical facility, whether it's a hospital or a clinic. The other one would be to do an outbreak strategy where we go into a long-term care facility or a meatpacking plant. And in those situations, a long-term care facility, we would test everyone, all of the residents, and all of the staff. And so as you can imagine, those vary greatly. And then we would do it over the number of days required to complete that testing. When we went into the House of Corrections in Milwaukee, for example, I think took us at least 3 days to get everyone tested there. And then the third type of site is what we're calling a true community-based site, which is a drive-up or walk-up testing site that anyone who has symptoms can come during the opening hours and get testing. And we've had great numbers. Originally, when we first started this, the template that I mentioned in the last question that we got early on from New York and Maryland and Washington estimated that we could process about 150 samples in a day with a testing team. And the number of that team, it varies from about 25 to 30 guard members per team. And so 150 was the original estimate we were using. Well, we found that with the swabs that are less invasive that we're using from Exact Science, and also then refining that process where we're able to test upwards of 400 people a day at some of these sites.
Thank you. We'll go next to Rich Kramer with Wisconsin Public Radio. Rich, a reminder, *6 to unmute your line. All right.
Okay, I think I'm in there.
We can hear you, Rich.
All right, we got you.
So, two-part question. Why are the community testing sites needed if we're seeing some hospitals laying off staff? Is it to try to allow them to go back to normal operation and move people that are potentially sick with this virus elsewhere? And then the other is with regard to the gateway metrics that were released today, I noticed that one seemed to have changed. So once those dots turn green, do they stay green or can they go back depending on realities on the ground? Thank you.
I think I'm going to pass both of those to you.
All right. So why we need community testing sites is because in order for us to know where the virus is and to know that we can protect people, anyone who has COVID-19, we need to dramatically increase access to testing. One of the keys to opening up Wisconsin is to know who has the virus and to make sure that those who have the virus are isolated and that their contacts who may be about to become ill are quarantined. And so this virus is very pervasive. We have had fairly limited testing, and our testing has been limited to the most sick people. And so this is a new approach because we have been able to increase our capacity for testing so dramatically in Wisconsin. I want Wisconsinites to know we are in a very enviable situation in the United States. We are in the top 5 of states across the nation with access to testing. And largely that's because, again, the great work of our clinical labs across the state and entrepreneurs like Exact Sciences who have added significant resource to our testing capacity. So that means we can implement a strategy that is similar to places like South Korea that did extensive testing to know who has the virus so that those who have it can isolate it, not transmit it to others. That's the philosophy behind this and why we are extending community testing. We are also working very closely with our healthcare partners and encouraging them to increase testing as well. So it's a multi-pronged strategy, and it's not one or the other, it's both and. And the second question, can you remind me, Rich?
Oh, the gateway?
Oh, the gateway criteria.
Yeah, the gateway. I noticed
Yeah.
when I was trying to get ahead of this meeting and do some writing.
You bet.
But the metrics have already changed since then, and I'm just wondering, once those dots, for lack of a better term, turn green, does that mean they stay that way until the economy starts to reopen, or can they go back and forth? Can
Yes.
new data come up and cause them to go red again?
So You're absolutely right. We put up 3 new gating criteria today focused on hospitals. And one of those metrics is green, a decreasing trend in healthcare worker infections. And so we hope that stays green. That is the metric that I believe is green. And we hope it stays green, but if we suddenly saw an increasing trend in that metric of healthcare worker infections, it could change to red again. So each of those are point-in-time measurements generally over the last few weeks, because what the gating criteria are there to do is to help us understand when it is safe for us to begin to interact more frequently with each other. Because when they are green, it will mean we have reached a point where the virus is not spreading as much as it is now, and it also will indicate our hospitals are ready and at a point they could accept COVID patients if we did end up having a resurgence of the disease.
Thank you. We'll now go to Stephanie Hoff with WisPolitics.
Hi, I'm wondering, you said there's 25 teams. Does that mean that there's 25 testing locations? Or how many testing locations and how many teams per testing location?
Hi, so 25 teams. We could potentially do 25 different locations with the 25 teams. And in fact, actually, we do have one team right now spread between 2 of the Milwaukee Health Services clinics in Milwaukee. So I guess there are more options than just 25. But the way we have that set up is it can be any combination of those 3 methods of testing that I mentioned earlier to have the 25. And just a reminder, we don't have 25 today. We're in the process of bringing on those additional soldiers and airmen so that in the next 2 weeks we'll have 25 teams. But so right now, today, in fact, we have 7 teams out today actually testing. And so the other part of that is there is a lot of advanced work required in order to set up a test site. And there's also a battle rhythm, as in there'll be days on and days off, or rest days for these teams. So we won't probably have all 25 teams in action on any given day. They'll be in some period of either resupply or rest, but the majority of the week they'll be in testing once we get the 25 teams set up.
Thank you. We'll go next to Bob Haig with Wisconsin Radio Network. As a reminder, *6 to unmute your line. We'll move on to Asal Razay with Spectrum News 1. Again, as a reminder, *6 to unmute your line. We'll move next to Meg Jones with the Milwaukee Journal-Sentinel.
This is a question for General Knapp. General Knapp, do you know the current number of Wisconsin National Guard troops who have tested?
Hi there. I was just wondering, a couple of weeks ago there were talks of the National Guard.
Hi, Meg Jones is currently asking a question. Is this Spectrum News? We'll go back to you after Meg.
Yeah, thank you.
So I was just asking if you happen to know the current number of Wisconsin National Guard troops who have tested positive for coronavirus. And will any of the people who recently returned from Afghanistan, will they be used for coronavirus work at all in Wisconsin?
So the 2 questions. So the first question, how many people we have. As we've mentioned before, we don't talk about the exact numbers, but I am happy to report since the last time we did this last week, we have not had any new cases of COVID-19 among Guard members. We did have one positive case of a family member of a Guard member. So that's great to not have any cases in the last week. And then the other part, the recently returned troops from Afghanistan, as of right now, they definitely could. Right now they're in a redeployment period to reconstitute and basically get to know their families again and settle back into society. So we don't plan on tapping them anytime soon, but there is a possibility, depending on how long this goes, that they could also be helping in the fight against COVID.
We'll go back to Spectrum News 1. You had a question?
Yes, I did. Am I still unmuted?
You are on now. We can hear you.
So I was just wondering, a couple of weeks ago there were talks of having the National Guard possibly at motels or hotels across the state, using those as isolation centers. Has that happened, or is that still happening?
Okay, that's a great question. We do have an isolation facility set up on the south side of Milwaukee that is in a hotel, and that probably is what you saw that you're referencing. And the National Guard is providing medical monitoring and administrative support to that isolation facility. In terms of other isolation facilities around the state, there are many other isolation facilities that have been set up by local communities around the state, but the Wisconsin National Guard is not assisting or participating in those setups.
Thank you. We'll go next to Morgan Wolf with NBC 15. As a reminder, *6 to unmute your line. We'll move on to Gwen Gunther with the Wheeler Report.
Hi, I have a question regarding the Badger Bounce Back program and the various phases that you have. One of the actions you have listed is stop unnecessary visits to nursing homes, congregate facilities, and hospitals. Can you tell me what you are defining as unnecessary visits? Because you have this through getting a vaccine, and does that include hospice centers?
So we know that people who are ill and people who are older are at increased risk due to this virus. And we also know that we can have asymptomatic carriers of the virus that can put people in those vulnerable situations at risk. So it seems most prudent that we reduce the number of visitors to all of those settings as much as possible until we can properly protect people in long-term care facilities, in nursing homes and hospitals until we have virus. Now, we also know that creates incredible challenges for families. And so as we move along, we will need to make accommodations around that. And even today, we know that when people are close to death, that there can be accommodations made to be with a family member. And so it is something we'll have to continue to revise and look at and balance the risks to our most vulnerable with the needs for things like family and emotional support.
Thank you. We'll go next to Rebecca Klopp with WTMJ4. As a reminder, *6 to unmute your line.
Hi, thank you so much for taking my call. My question is for the Deputy Secretary. Today, during the Supreme Court hearing, the justices expressed a lot of skepticism with the Safer at Home order. First, what's your reaction to the justices today, and do you think that the government will remain closed, and do you think it should remain closed? or the safer at home order should be
So
remain.
I want to be really clear what the Safer at Home order does. The Safer at Home order reduces the amount of interaction between people in order to reduce spread of this very serious virus. Under Safer at Home, because we have essential businesses open, we have a number of, we are not a closed society. Many acts of daily living are still happening in our state. And that was the balance that was struck with that order in order to keep important and essential work moving forward and protect citizens of Wisconsin. As the gating criteria that we've established in the Badger Bounce Back Plan indicate, we still are seeing prevalence of COVID-19 throughout our state. And so we need to still continue to take precautions until we can see significant reductions in that. And so those precautions continue to need to be more social distancing or physical distancing, less interaction between different groups of people, and the kinds of interventions we're putting in place to contain the virus as we do go out in our essential businesses and may go out in the future in more interactions, which is testing and contact tracing so that we know that people who have this virus are identified and appropriately isolated. So we're still on a path to protect the people of Wisconsin, and those of us working together here at the State Emergency Operations Center will continue to be on that path moving forward.
And lastly, we'll go to Brandon Arbuckle with WISC TV.
Hi, General Knapp. You had mentioned the Resch Center is one of the newest community testing sites in Brown County. Are there any other specific counties or areas throughout the state that the Guard and DHS have been looking at to possibly add another one of these community testing sites at this time?
Yes, definitely. The Resch Center was just the first one. There's another one opening up in Brown County and Green Bay tomorrow at Casa Alba will be open. And then I have an entire list of other counties where we have scheduled openings of additional community testing. I'm really excited about it. It's in addition to the hospital systems, like a question asked earlier, doing testing, this really increases the throughput. And it really gets to that widespread testing need at a rapid pace. Like I mentioned, being able to do upwards of 400 tests at one site in a day, it would be very difficult for a hospital without a drive-through. If they had a drive-through, I think they could do the same thing. Or a clinic to get that many tests through. And the other advantage that we offer with the Guard, I've mentioned before, is our ability to have reusable PPE. So you'll see in a lot of the news spots I've seen and the photos that are in the media out there of our Guard troops, and they have some pretty substantial suits on. And in one of the comments I saw, people said that they were scary suits. And I just want to tell you that that there's a reason that they're wearing those suits. It's because they're reusable. And we're helping to preserve that really valuable PPE resource for the medical providers around the state. But yes, we've got a lot of them coming up. We're getting requests every day from counties all over the state to set up more sites, and I'm really hoping that we can get all of those 25 teams actively engaged in the next week and a half.
Thank you. That will conclude today's media briefing. The broadcast will be available on the Department of Health Services YouTube channel. For the current updates on the state of Wisconsin's response to COVID-19, please check the Department of Health Services website. Thank you for joining us today, and we will be back next week.